stroke and the physical, psychological, and emotional impact it has on an individual's life. We will also be discussing rehabilitation and the importance of collaboration between multidisciplinary teams. Our first guest is Dr. Derek Shepard, a therapist who has worked closely with many stroke survivors during their rehabilitation. Thank you for joining us, Derek.
Oh, it's a pleasure to be here.
It's great to have you. So tell me, Derek, what do you do with these stroke survivors?
Well, what people fail to realize is not only are these stroke survivors experiencing many physical deficits, but they also experience a loss of independence, a loss of privacy, a loss of self-esteem, among other things. So the first thing that, as a therapist, I like to do is I have to help these patients come to terms with their condition. And once we're able to do that, I'm able to provide support for these patients throughout their journey as they rehabilitate to, try to get back to what they consider to be normal.
Patients often experience loss of independence, self-esteem, and experience role changes within the household. Therapists work closely with patients and their families to establish goals or outcomes, such as having patients express positive feelings of self-worth and help set realistic goals to achieve higher self-esteem and promote satisfaction, independence, and control. Therapists support patients who have suffered a stroke by encouraging the patient to identify strengths to facilitate patients' recognition of intrinsic value. They monitor levels of self-esteem over time as appropriate to determine stressors or situations that trigger low self-esteem and to teach coping mechanisms. They also monitor whether the patient can look at the changed body part to determine patient's level of acceptance of their new image. Closely with stroke patients to rehabilitate physical function. Welcome to the show, Alex.
Well, thanks for having me.
It's good to have you. Can you tell us more about what you do with these stroke patients?
Well, you see, depending on the severity and the location of the stroke, it can determine whether the patient simply has, problem moving around the house, or it can be as far as not being able to even feed themselves or brush their own teeth. So depending on my client's individual needs, I like to work out and, design a rehabilitation program with the hopes of maximizing their ability to do these activities of daily living so that they can restore some degree of independence.
Oh, thank you for sharing.
Okay.
Physiotherapists work closely with patients to work on developing muscle strength and increasing the ability to move. They use adaptive equipment to work on this and work through multiple exercises as determined in their plan of care. They work in developing and executing the exercise program to determine the extent of the problem and plan appropriate interventions. Physiotherapists also work closely with patients to work on range of motion exercises. They also encourage patients to practice these independently as indicated to promote patients' sense of control. And after this, they provide restful environments for the patient after periods of exercise to facilitate recuperation. Appropriate meal plans for their specific dietary needs. Welcome to the show, George.
Hello.
Hello. Can I assume by your outfit that you wore that you enjoy cooking?
Well, I wear this every day, so.
Okay. Well, can you tell us more about what you do every day?
Well, what I find is stroke patients often suffer from something known as dysphagia, which means that they have difficulty swallowing when they're eating their food. So what I do as a dietitian is I work with these patients so that we can determine, a meal plan where we find foods that, they're able to swallow more easily depending on what the texture is and, other things like that.
Oh, okay. So would it be safe to assume that a liquid diet would be better for people who have difficulty swallowing?
Not necessarily. See, if a patient that has dysphagia happens to have a liquid, there's always a chance that they can do something called aspirating, which essentially means that they'll be choking on the liquid.
Okay.
So what we like to do is we thicken these liquids so they're more easily swallowed while reducing the risk that they aspirate.
Oh, okay.
Yeah, and also, like, among other things that we do, depending on the degree of dysphagia, we can chop the food up in something called mincing them. So it'd be like chopped into really small pieces. Or we can go as far as pureeing them, which means we essentially just blend them to the point where they're the same texture as, like, say, a porridge or something like that.
Oh, okay.
Yeah.
Well, thank you for sharing that with us.
No problem.
Patients often experience difficulty eating, swallowing, and meeting nutritional requirements following a stroke. Dietitians work closely with patients to assess their ability to swallow and develop a meal plan suited to their specific needs. Patients to reestablish their ability to speak. Welcome, Jackson.
Hello.
Hello. Thank you for joining us.
Oh, no problem at all.
So can you tell us a bit more about the process that you go through with these patients?
So in my experience, I'm finding that a lot of stroke patients are having problems with communication and communicating with other people. So depending on the individual needs of my clients, I work with them and we do like a variety of exercises related to exercising their mouth and pronouncing words, and like we also like to get technology involved and use like certain apps to have people give them a chance to practice this at home, and even maybe get their family involved and helping them just communicate a little bit better.
Oh, okay. Thank you. Patients experience difficulty communicating following a stroke. Important interventions include exercises that promote motor control, and patients are encouraged to use simple words and short sentences as appropriate, while avoiding overwhelming the patient with verbal stimuli. Patients in the community to meet various needs as determined in their plan of care. Welcome, Richard.
Hi.
Hi. Can you tell us more about what you do with these patients in the community as a registered nurse?
So, despite all the support that these clients are receiving from the multidisciplinary team, it still happens to be that they do need a little bit of help, like doing a lot of things. So that's where us community nurses come in, and we help them with everything from getting washed up and getting ready in the morning to taking medications, taking them to their doctor's appointments, even helping them, get their meals and help them eat, and pretty much anything else you could think of for daily tasks.
Okay, so as you know, we've had quite a few professionals on the show today that work closely with these patients as well. So is it sort of safe to say that you work closely with these other professionals as well and sort of implement these different plans of care from these different areas and try and sort of holistically make that work?
Yeah, absolutely. Like as you can tell by now, collaboration is a major part of rehabilitating these stroke patients. So like I'd like to work very closely with other professionals and also with the client themselves to reach their goals and help them live more independently and just improve their overall quality of life.
Oh, that's wonderful. Well, thank you for joining us, Richard.
Oh, no problem. Happy to be here.
Registered nurses collaborate with multidisciplinary teams to implement appropriate care plans for patients in the community. They assist patients with taking medications, getting dressed and washed for the day, and with many other activities of daily living as determined in their plan of care, as well as assessing them on a daily basis. Their overall collaborative approach assists in the rehabilitation of the individual and works to achieve optimal quality of life. Thank you for joining us today, and we hope that you learned something about the loss associated with strokes and the rehabilitative efforts that are put in place by multidisciplinary teams. Their collaborative approaches work towards improving quality of life of these patients. Thank you.
Thank you for watching, everybody.
Alright, we're done. Okay, I'm going home now. I'm never coming back here again.